formal. This is a very formal room, but please redirect me, raise questions as I go along. If you feel like I'm going over ground that's not the right ground or things that you already know, but let me get started. So my assignment, if I understand it correctly, is to give you a little bit of background on the so-called Patient Protection and Affordable Care Act. Tell you what's going on in New Jersey regarding the implementation of that law, and then maybe looking ahead, assuming we do implement it, and I guess there's some doubt about that, how healthcare coverage is likely to change in New Jersey. So I'll probably refer to it as the ACA. Some people call it PPACA, ObamaCare, whatever you want to call it. So, of course, we know that the law itself is under review in the Supreme Court. I'm going to talk about what I think will happen if it's upheld. And if it moves forward, I guess in Q&A, if we want to talk about prognostication about what the Supreme Court might do, we can do that. But it's, at this point, speculation. So I'll start with a brief overview of the 2,400-page law. I'll try to do it in just a few sentences. So, as Wink said, I come to this discussion as an academic from Rutgers. Oops, the light just went out.
Oh, okay. I think we can hear you if you speak loud.
Should I try this? All right. If it starts cutting in and out, I'll just talk loud. It's a little easier for me with this. So. My center is mainly a research organization. We've done work with every administration in New Jersey since the Whitman administration. We feel that our contribution is by doing impartial work and bringing facts into the debate, convening the various stakeholders. So we don't take positions ourselves. I think that's just sort of important background for knowing where I'm coming from here. It doesn't mean I don't have a point of view. I do, but I'm going to try to stick to the facts. Okay. So some of the work, what I have to tell you today really is derived from work that we are doing for the state that's funded through the Affordable Care Act. Some of it's funded by private foundations. We're committed to transparency, and any report we do is posted on our website, and if folks are gluttons for punishment and want to read policy briefs and the papers that I'll be talking about, I can certainly direct you to the website. The standard disclaimer applies. What I'm about to say is my views, not those of our funders. So let me start with what is the Affordable Care Act? What's in it? Well, it's arguably the largest overhaul of the United States, of the American healthcare system since Medicare and Medicaid in 1965. Its reach is extremely broad. I'll just touch on a few of the highlights as they relate to health insurance coverage. First, according to the Congressional Budget Office, when fully implemented in 2014, the Affordable Care Act will cover about half of the uninsured people without coverage. It does so, first of all, and obviously most infamously, by requiring most people to buy health insurance, the so-called individual mandate. If they fail to buy, they'll be subject to penalties. It also includes some penalties for large employers, those 50 or more, that don't offer qualified coverage and do their share to pay for it. Small businesses are not subject to penalties, although there are some carrots for the smallest businesses with the lowest wage workers. So about half of this new coverage will come through the expansion of the Medicaid program. Medicaid is the program jointly financed by the federal government and the states, covers low-income people. And the other half, or most of the other half, will come through some new entities that are called health benefit exchanges, which are supposed to become available late in 2013. When the mandate kicks in 2014, they'll be fully operational in theory. So eligible people either for the Medicaid expansion or the new exchange subsidies the new exchanges will be eligible for tax credits to buy coverage. And this applies to people up to 4 times the federal poverty level. So to put this in perspective, that's about $92,000 a year for a family of 4. So there'll be at least some help. The tax credits are just sliding scale. The closer you are to 92, the less you get. The poorer you are, the more you get. This is a large group of people. Just based on the income numbers alone, about 2/3 of all Americans are below 400% of poverty, while 55% of New Jersey residents are below that threshold. So there are some other rules, immigration, you have to be legally present to be eligible for these subsidies and so forth, but it's mainly based on income. So the second major part of the law changes the rules of the game for private health insurance. So here are some of the more important rules in my view. Starting in 2014, and actually even currently for children, nobody can be turned away because of their health. No pre-existing condition exclusion. Insurance companies are no longer allowed to rescind policies except in cases of clear fraud. There are also caps on the amount of administrative costs, including profits, that insurance companies can make, and it's calculated as a percent of payments for medical services. Insurers may no longer impose lifetime dollar limits, or eventually lifetime, or rather annual dollar limits on benefits. And as I think one of the more widely known features is that young adults up to the 26th birthday can stay on a parent's plan. There are other rules as well, but those are some of the big ones. Third, the law seeks to improve healthcare quality and efficiency in dozens of ways. Mainly by changing the way Medicare and Medicaid pay for services, moving away from the just rewarding more volume on fee-for-service payments to linking payment to quality, performance-based incentives. The law also makes some changes to Medicare, and this applies both to Medicare and private insurance. Certain preventive services that are deemed highly effective have to be provided at no cost to the beneficiaries. No cost sharing. Also notably within Medicare, the so-called donut hole, the coverage gap, prescription drug coverage gap is closing and will be eliminated, I think, by 2020, so the cost sharing will be the same. There'll be no more donut hole at that time. And presently, I think about half, 50% of the cost of name brands are now discounted, and generic discounts are going to be ramping up over time. So some of the provisions of the Affordable Care Act are already in effect. So for example, in the young adult coverage, an area that we've been working on, about 2.5 million young adults who would have been uninsured now are covered under a parent's plan. That's a big accomplishment. But most of the coverage provisions start January 1, 2014. So that's a quick overview of the Affordable Care Act. I can cover the other 2,390 pages if you like during Q&A. So how is the state of New Jersey responding to its responsibilities under the law? Well, first, what are those responsibilities? And states do have major new responsibilities and opportunities under the law. They're foremost required to expand their Medicaid programs to cover more people. The Medicaid programs do away with a long list of categorical eligibility criteria. Whether one has children, for example, is no longer going to be considered in whether you're eligible for Medicaid. It will be based solely on income. States also have the option of creating these health insurance exchanges, and the federal government will pay for the startup of those exchanges, and then the states can operate them. Or if the states choose not to, and there's a few states that are on record saying they're not going to do exchanges, then the federal government will set them up for the states. Turns out that's a huge incentive to get the states off the dime because they don't really want the feds doing this for them or in the view of some to them. So where does the Christie administration stand? As you may know, like I think most other members of his party, Governor Christie is on the record opposing the Affordable Care Act. He's been clear that he's not a supporter of the law, although New Jersey did not join the lawsuit that's under review in the Supreme Court right now. The governor said it's not a good use of state resources to do that. And in fact, I would argue that Governor Christie and his administration has done everything possible to not discuss their position on the Affordable Care Act. And when pressed, they say as little as possible. But at the same time, the administration has been moving forward rather deliberately and systematically to review their options and prepare for the implementation of the law. There's a whole range of grants available through the Affordable Care Act from the federal government to the states to plan the exchanges, to implement the information technology platform for the exchanges, to improve health insurance premium rate review procedures, and so on. And New Jersey has taken every dollar available to them to do this. Not true in other Republican-led states, but certainly true here. The governor created an interagency task force to put all of this together, and that's the group that we're working with on implementation issues. Having said that, the governor has made no public commitment to doing this. In fact, he's on record recently saying that he's not even going to discuss it until the Supreme Court rules. I would predict that it's even after the Supreme Court rules, which will be probably by the end of next month, that he still won't want to talk about it, at least until the November elections. He may have to. We'll see. So, of course, New Jersey also has a legislature. Sometimes reading the media, we forget that. The governor's in the press so much. But the legislature, which is in the hands of the other party, has done what they can to move the ball down the field. So the legislature passed a law that authorizes the creation of the New Jersey Health Insurance Exchange. That law, or that bill, is sitting on the governor's desk. He has not signed it. He has until, I believe, May 10th to either sign it or not. And if he doesn't, then it's pocket vetoed. I don't believe that anyone believes that he will in fact sign the bill. There are a number of things in it that his constituents don't like the way it's governed. There's, for example, a lack of representation of insurance companies on the board of this new entity. There's some other things in there that the governor is not ready to take on, to my knowledge. So he'll either veto it, pocket veto it, but doing nothing, or he may conditionally veto, which is essentially rewriting it and sending it back. We'll see soon enough. Okay, so let me turn to my final question, and that is, if we do implement this thing, what will happen to health insurance coverage in New Jersey? So we did work creating some projections for the state planning process so that they know how big the exchange would be, how many people would come onto Medicaid, and so forth. And I can give you some of the main findings of that work. Currently, there's a little over 1 million people in New Jersey with no health insurance coverage, between 1.1 and 1.3 million without coverage.